Hi, everyone. My name is Gabrielle Gerke, and I am a senior at the University of Missouri studying health sciences and with an emphasis in leadership and policy. I am currently interning with Missouri Rural Health Association, and vaccination has always been a strong interest of mine. It's always been something I've been intrigued by, why people do it, why they don't, et cetera. And so over the semester, I've really gotten to the opportunity to dive into vaccination in rural Missouri. And today I'm going to be talking to you about HPV. So HPV is human papillomavirus. It is the most commonly contracted STD in the United States. And it's estimated that over 80% of sexually active people will contract HPV in their lifetime. There are over 3 million cases in the United States per year. And in addition to this, there's over 100 strands of HPV. So it's everywhere. And there's 30 that infect the genitals, like over 30, but then there's 13 of these strands that are considered extremely high risk because they are cancer causing. So how HPV works is it induces genomic instability in the cells, and this makes them susceptible to genetic alterations. So some of the threats of HPV is that it can lay dormant, and many people don't even know that they have HPV. It doesn't always show physical symptoms. And so these people can continue to spread it. In addition to this, it's not even on like the common STD panel when you get tested. So HPV can cause warts, skin tags, and even cancers. This includes genital, cervical, oral. And it's actually currently being researched if it can cause throat and esophageal cancer. And so 90% of cervical cancer cases are also caused by HPV, and it causes over 35,000 new cases of cancer per year. And if you look at this graph, you can kind of see what I'm talking about here. This graph is showing cancer types in correlation with the percentile linked to HPV. So as you can see, cervical, we're at 99.7%, and this is cases linked to HPV, and this is all cases of cervical cancer. Anal cancer, we're at 90%, and so on and so forth. So it's a very, very serious, it's a very harsh reality that it's a serious virus, and without intervention, HPV can and will cause cancers. So there's a couple misconceptions about HPV. It's not only a threat because it's commonly spread, but because of its multiple transmission modes. And although it is considered an STD, it is not only spread through sexual contact. It can be spread through skin-to-skin contact or cuts on the skin, abrasions. In addition to this, it can also live on surfaces for days. And if you think about it, think about how many surfaces kids coming into contact with HPV, or into contact with surfaces that could have HPV every single day. It's also another misconception that only girls can contract HPV. This was the long time people believed that it was only girls could be affected by HPV, but this is false. Boys can also be infected with HPV, and over the past 10 years, the HPV vaccine has become available for boys and girls since it's been proven that it can infect anybody. So how do we prevent HPV? The number one way is going to be getting vaccinated. That is the best way to prevent HPV. As an adult, condoms can help prevent, but they still are not even getting close to approaching the effectiveness of the vaccine, because they don't protect against open wounds or other skin-to-skin contact, and you can still get it, as I said earlier, you can get it from surfaces. So a little bit more about the HPV vaccine. The HPV vaccine, it's relatively new. It was introduced in 2006. The one available in the United States is known as Gardasil. So there's a lot of different worries about this vaccine. Can this vaccine cause an infection of HPV? No. The vaccine is made from a non-infectious protein of the virus, so it can't cause HPV infection, and it can't cause HPV cancers. Studies have shown that this is an extremely effective vaccine. It has little to no side effects. When you get the vaccine, it's very similar as getting any other kind of shot. They're very mild. It can include pain and redness, some mild swelling, sometimes nausea or a headache, but all of those effects typically go away pretty quickly after the vaccine. So in addition to this, it's most effective at ages 10 to 12, because this is prior to the patient even getting into contact with HPV. And this is when it's most effective. Once you have HPV, you cannot get the vaccine. Providers will not give you the vaccine. And those providers won't even give you the vaccine after you're 18 or 21, right around those ages, since the likelihood of being infected is already so high at that point. So yeah, it's an extremely safe vaccine. You're less likely to develop cancers, and you won't have any. There's no fertility issues caused by the vaccine. You're actually less likely to have fertility issues if you get the vaccine because you're lowering your risk of cancer. And if you don't get as I said before, like if you don't get the vaccine at a young age, most providers will not offer it to you at a later age. In addition to this, if you get the vaccine later, you like if you're like 16, 17, something like that, you will have to have multiple doses. And that also, yeah, it's just not as effective. If you're 10 to 12, it's one shot, one and done. It lasts for 12 years. Like it's a very safe, very effective vaccine. So I wanted to talk a little bit about vaccination in rural areas since I am working with Missouri Rural Health Association. So I'm going to be talking a little bit about Clinton, Missouri is what I'm going to be using as my example town for this example. So those living in rural areas are 40% less likely to get vaccinated. This is mostly due to lack of access, lack of providers, lack of access to vaccines, stuff like that. So for example, in Clinton, the population is about 9,000, a little over 9,000, and there's only about 3 pediatrician providers in all of Clinton, Missouri. So why I bring this up is that although your provider should bring up the HPV vaccine, there's a chance that they won't. It is considered an optional vaccine, although it should be required. But there's a chance that they won't bring this up. And so this is a chance for your parents to be able to advocate for their child's health. This is an opportunity for you to, get the best healthcare for your kid. This is a cancer-causing virus. It causes cancer. So there are some parental concerns, obviously. It seems like a young age to be talking about STDs. I know that when you're 10 to 12, that's young. But this is the best age to give your child full protection against HPV. There's no impacts on fertility from the vaccine. It lasts 10 to 12. It lasts 12 years at a minimum. It was still showing full efficacy at 12 years past getting the vaccine. So you're getting your child protection against cancers for a lifelong disease. Like you are protecting them from cancer. There's no other vaccine out there that really protects you from cancers, So what do you do now? Where do we go from here? So talk to your provider about the HPV vaccine, start bringing it up. So the vaccine costs about $250 per dose, but most insurance companies will cover this. And there are other low cost options at Planned Parenthood and things like that. So you can look into those options as well. So you can find more resources through the CDC, Planned Parenthood, and Medline Plus. That is all that I have for you guys today. I appreciate you taking the time to listen and have a good one.